What is a facelift? Well, a facelift is really a surgery to address the lower part of the face, typically from the mouth area, along the jawline and the neck. All that tissue is lifted up in order to tighten those areas and get rid of extra skin and tighten the underlying muscles. There are many different types of facelifts out there, depending on what level the tissue is being elevated and supported. So you could do a facelift where just the skin is pulled up. But typically what we like to do is a facelift where the skin and the muscles are supportive, which gives a longer lasting result and typically a better definition of the jawline and the neck. So the muscles of the cheek and the neck are pulled up along with the skin, and that's typically called a subsmass or a deep plane facelift, in contrast to a subcutaneous facelift, which is just under the skin and the fat. What is the difference between a facelift and a neck lift? Well, really, they're very similar. A facelift always addresses the jawline and the neck. An isolated neck lift really just addresses the neck itself and maybe a touch of the jawline. Most of the facelift and neck lift incisions are around the ear. When just doing a neck lift, the incision sometimes can be hidden just behind the ear without going in front of the ear. And occasionally there are neck lifts that can be done through just an incision under the chin or in front of the neck. Typically, in order to really address the jawline and the neck, a facelift is required, which hits all those areas. So we often use a facelift and a neck lift synonymously, but a neck lift is a slightly more specific and less involved procedure. Where are the scars placed, and will they be noticeable after facelift surgery? Facelift surgery scars are designed intentionally to be in places that are difficult to see. Specifically, there is a scar either in the hair or just in front of the hairline, and it comes under the sideburn, and then along the little notches of the ear in order to hide in those notches and in the irregular contour and in the shadows. And then it curves around the earlobe and behind the ear, and then either into the hairline or along the hairline behind the ear. There's also often a little incision under the chin. Fortunately, all of those areas, because of the contour and the shadows, they typically are pretty easy to hide, even within a few weeks after surgery. In addition, for people that wear longer hair, the facelift scars can be hidden very easily, very soon after surgery. In addition, most people that get facelift surgery have scars that heal quite well, just because of the anatomical location and because of the support sutures that are placed underneath. So the scars typically heal as very fine lines in most patients. What is the healing time after a facelift? Healing after a facelift is actually quite fast. There is a bandage that goes around the head and stays in place for about 5 days. Sutures are removed at about 5 to 7 days after surgery, and there can be some residual bruising and swelling that can last about 2 weeks. But most people are able to get out in public and get back to normal life in about that 2-week time range. Is the skin treated as part of a facelift? Facelifts generally pull and tighten the skin and the muscles, but they don't really treat the surface of the skin. So it doesn't change the texture of the skin. It doesn't get rid of fine lines. So one way that we can treat the surface of the skin at the same time as a facelift is by using a laser, often a CO2 laser, that helps remove the outer layer of the skin and smooth the skin at the same time as pulling it tighter. Those two procedures are very often done together, but they don't have to be. So it is optional to either do just a laser treatment or just a facelift treatment, depending on the individual's anatomy and the person's goals and recovery time. Do I have to wear a garment after facelift surgery? Typically after facelift surgery, we do put a bandage around the head for about 5 days. That offers some support to the neck and it helps with reducing swelling. After that bandage is removed, most patients will typically have a supportive strap under their neck that goes around the top of their head that's in place for anywhere from 1 to 2 weeks. Sometimes we'll have patients just wear that supportive strap at night. So yes, there is a garment involved, but really the garment only has to be worn for about 2 weeks and not even all day and all night during that period. So the recovery time is really quite fast.